Hello everyone, today you're going to watch me place a dental implant. This is Dr. Tamisha Denis and this is the Modern Slime. So today I'm going to be showing you an implant that I did in my office. I'm going to show you some raw footage from an implant I did a couple weeks ago. This patient was very kind to allow me to film. Some people ask me why I don't film very much more often. First of all, it takes a little time out of my schedule to kind of set up the camera and all of that. And I also have to get the permission of the patient to film. But she was gracious enough to let me film this video. I didn't get the chance to start from the very beginning with the injection and everything like that. But this patient, she had a tooth missing on the upper left that she had extracted, I would say anywhere between 2 or 3 months ago. She takes really good care of her mouth. It was just unfortunate. I think the tooth had a root canal previously and it broke and another dentist extracted it. And so what we did is we were going to add one implant to the back of the area where the tooth was extracted. Yes, she needed more teeth than just that one implant, but every time you have teeth missing, you don't necessarily have to get every single tooth that you have missing. You really just get essential ones that allow you to chew and allow you to have balance on both sides of your mouth. So I'm going to walk you through this implant. Unfortunately, I don't have zoomed in footage so that you can see everything up and close, but I'll kind of describe all of the things that are happening. All right, here we go. So the first thing that you're going to see, and excuse our heads, we have a gorilla pod that's hanging from the light fixture above the chair. So our heads often get in the way. But the first thing you're going to see me do, I've already opened up a flap, and if you're curious to see what that looks like and you check out my video of my own dental implant being done, so we open up a square in the gum, we call it a flap, and after we've done that we push the gums back and then we start to use a drill that starts to create a small hole that little by little becomes a bigger hole. We call that an osteotomy. So we go in there with something called a 1.8 millimeter pilot drill. After the pilot drill, we'll go to a 2.2 millimeter drill, and then we'll keep going until we eventually reach the size and depth of the implant that you want. So if you can see, I'm actually going down underneath my cabinet, and that is where I keep my implants. My implants, if you could see in that red box, and the camera can't go up to show you what's on the counter, but inside of a sterilized box in plastic, it's kind of sealed a couple times like Fort Knox, my assistants like to joke, is the implant. And you can see me opening it up. It has a green cap on it. And I tried to take it out at the last minute right before I'm about to place the implant. So I've done all the drilling. You can see it upside down in that container. I open up the area. I keep the implant covered right up until the moment you'll see me in a minute kind of just drop it onto her bib on her chest and then place the implant in right away. The drill speed when we're doing the initial drilling is really fast. I dropped it really quick. You couldn't even see it then, but the drill speed is really fast, about 1200 RPMs. When I'm placing the implants, we're about 35, and also a torque, which is the strength that it takes to place the implant. She's feeling absolutely no pain right now. Maybe she'll feel some vibration and rotation as the implant goes in. And what I do when I place the implant is I'll put it in initially with the drill. And the next thing that I'll do is get a torque wrench. Yes, it is called a torque wrench. And I'll get the torque wrench and kind of lower the implant or screw the implant down until it's about 0.5 millimeters below the gum line. And that allows the implant bone to drop just a little. And so here you can see the torque wrench. I kind of put it in place and I'm winding slowly. My assistant is suctioning the blood just so that I can make sure that I'm right below the gum line, because even though implants are more functional appliance, we do care about cosmetics. We want it to be so that you can't see the silver rim of the implant or the abutment, and in order to do so we got to make sure that that implant goes all the way down. So I'm at the counter, and what I'm doing now is unpackaging the healing cap. That's it right there, that green little thing. And it is a short screw that goes into the top of the implant well, and so that when the implant is healing, nothing can get into the little hole. Now that hole is actually going to be our access point for us to later screw in the abutment, which is going to hold up our future crown. So that is a temporary piece that we put. Most implant companies, I use Hyoscine, and most implant companies will actually color code everything so that green is a regular platform, too much information, and then purple is a mini platform. If you see here, I'm holding up the suture. So with the suture, we're going to suture the area closed. Remember, I opened up a flap, so our gums are a little bit open. I like to use non-resorbable sutures when I'm placing implants because I'd like the implants to hang out. I would like the sutures to hang out as long as possible. So during the healing, everything stays nice and closed. The bone stays nice and protected and in place. And basically the elements of eating and drinking cannot affect the implant. So I actually do usually a running suture with some knots in between to keep it as stable as possible. And for the most part, most people don't feel a lot of pain after. Even the sutures probably are a little bit more annoying than anything because sometimes they'll start to hang. In 2 weeks, when I see her for her post-operative appointment, some people will have the sutures left and some people will not, depending on the person. It really doesn't matter as long as the area stays closed. I tell people, even though I don't typically see them for another 2 weeks after their appointment, that they're always welcome to come back if they feel like something is not right, if they're concerned. Because I've literally been through having dental implants myself and I do them so often, I pretty much know what most people are going to experience and feel, and I try to detail it to them. Usually during the suturing process, I'm doing a lot of talking and talking about post-operative instructions. I'm talking about medications that they're going to be using, and even though I know they're not in the clearest state of mind because they're still in the middle of their procedure, everything is written on paper. And if they have a family member with them, she had her daughter with her that day, I usually will explain to the person, the loved one that is with them also, so that they fully understand what is it that we did and what is how to care for everything well. So again, I'm putting the sutures in for the most part. I tell people the less you do, the better. If you're there messing with it, trying to keep it extra clean, that's actually not beneficial. The body is really good at healing wounds in the mouth. So when you have an area like that, which is already stitched closed, your body is going to start to form a blood clot. And one of the important instructions that we give people after they have an implant or even an extraction is no spitting or sucking through straws. That includes smoking. And the reason that's detrimental is because your body is trying to heal. And if you're always pulling on it by spitting the blood out or by using a straw to create a suction, you actually delay the healing. And again, smoking also does the same. So everybody leaves with a packet of gauze that they bite down on. And also we rinse out and all that good stuff, but a packet of gauze that you bite down on and you put pressure on it. I tell most people, if it is pink and there's really not red blood, you can just stop because the body is going to take over from there. With my implant patients, I often tell them that they should refrain from eating and drinking for the next hour.
When love comes in, ooh la la la. Love comes in, ooh la la la.
So there it is. That's the implant that I did. I'm going to see her in about 2 weeks for her post-op appointment and see how she's doing. For the most part, she was an excellent patient in general, and everything went just the way that I had planned. Thank you for watching this video. If you like this video, please thumbs up. If there are other procedures that you'd like to see me filmed, let me know in the comments below, and just let me know about your implant experiences. You know, I've shared my personal experiences. And then also make sure to subscribe if you haven't done so already. Thank you for watching.